I just couldn't resist bringing you this month's newsletter video from this gorgeous location. I am currently in Chicago on Navy Pier at the Health Rosetta Conference. This is a group of over 800 people that are working really hard behind the scenes to disrupt our current healthcare system, and it's fun to be a part of it. Most people are working from the inside of the healthcare purchasing, brokering, and benefits sector, which I'm trying hard to understand. But there are also a lot of clinicians that are getting involved in this movement. Clinicians like myself that are frustrated with our current system and the way it's set up. Our current healthcare system is not set up to benefit the patients, you. It's also not set up to benefit the doctors and nurse practitioners providing care. It's set up to benefit all of the entities in the middle that are between us, and it's not fair. It gives me a lot of hope to be around all of these other people that see the same problem and are crafting solutions to work around it. I opened Heartland Weight Loss because I wanted to create a space where patients could get access to evidence-based medical care to treat the disease of obesity through health insurance, a disease that deserves treatment within the system along with every other chronic disease. I knew it was going to be difficult. There's a reason nobody else is doing it, and I was right. Since opening our doors almost 5 years ago, our ability to treat patients under the healthcare umbrella has gotten more and more constricted. The studies say that treating obesity most effectively requires frequent interaction, especially at the beginning, from a multidisciplinary team, which is the way I set up the clinic in the first place. Patients alternated visits between me and a health coach until such time they were ready to space their visits out and just see me. It worked out great. Patients rarely had a copay for the coach visits. Insurance didn't pay very well for them, which made it a revenue-neutral service, but that was okay. Patients were thriving, which made my job easier and gave me a lot of job satisfaction. COVID changed everything up on a lot of fronts. People needed even more support, and my coach was pulled into working for the hospital, so I contracted with an online health coaching company and spent a lot of time training the new coaches so that we were all on one page. And it was great. On top of their medical visits with me, patients often saw their coach more than once per month because it was virtual, and they loved it. Because it was outsourced, it remained revenue neutral, which again was fine. It didn't hurt us financially, and patients loved it. Then our biggest carrier, Blue Cross, pulled the rug out from under us. They said no more virtual coaching. They were only going to cover in-person coaching. We had to rip apart that virtual patient-coach relationship or make people pay out of pocket, hire and train a new coach, and resume in-person coaching visits, which was hard given that the pandemic was still going on. People were reluctant to be in person, and it's definitely harder to connect in a meaningful way when both of the people in a coaching relationship are wearing masks. But we plugged through it until Blue Cross decided they would no longer pay for in-person coaching either. As I was trying to figure out how to continue to provide this service without going revenue negative, the coach was hospitalized with a complicated pregnancy, spent months in the hospital, then more months in the NICU with her new baby, and the relationship ended. Rather than fill her role with a new coach and ask patients to pay for that service out of pocket, I decided that my clinical team, my doctors and nurse practitioners, and myself would fill that gap. After all, our services were still covered by insurance, and we actually do know a lot about coaching and teaching and encouraging. It's at the absolute core of being a healthcare provider. On our end, acting as both a provider and a coach in the same amount of time cost a lot of burnout and overwhelm, but we persevered. It was a decent solution. Patients that were able to come into the office a couple of times per month did pretty darn well, but a lot of patients had high copays and couldn't afford to pay that medical visit copay twice. Success rates declined a bit. Everyone was discouraged. With no other viable options under the umbrella of insurance, though, we plugged away. At the same time, insurance companies were putting us through massive amounts of prior authorizations and appeals. And then Blue Cross started denying office visits for medical care for most of their participants. It was the last and final straw. At this point, only a very small percentage of our patients with Blue Cross are getting visits covered, and most have very high copays, which means they are coming in only once per month. We know that this isn't enough to drive fabulous results, and my clinicians simply can't be a healthcare provider and a coach over and over again, day after day, month after month, all the while knowing the way it could be. the way it had been when we had a coach. It took a lot of soul searching and running spreadsheets and looking up regulations and mental processing, and at the end of it all, we decided, for the sake of everyone, we had to make a huge shift in the way we approach, the way we provide patients with the kind of care that we know they need and deserve. Because they are causing more harm than good, we are dropping Blue Cross completely at the end of 2023. Most of you with Blue Cross are already paying out of pocket, and due to coverage or high deductible plans, so many of you with other plans are also paying out of pocket. We have brought back a coach, this time a nutrition coach. When patients first get on this weight loss journey, they need to be seen twice a month at least by a multidisciplinary team. It's a better experience, and it's more cost-effective for the patient when insurance isn't helping us out to do this using a coach. Now, many of you have asked, because regulations are strict and we can't afford to cross the line into something that might be interpreted as fraud, we have to keep this coaching service limited to patients that are not using insurance to pay for their care. It has to stay separate from our insurance service. Yes, we know it stinks, but we don't make the multitude of rules that we have to follow, which goes back to why I'm here in Chicago, exploring and loving all of the innovative ways that people from all parts of the healthcare industry are coming together to solve these problems. I'm also, of course, making a plug to all of these people that treating obesity, using a multidisciplinary team, benefits patients in so many ways. Beyond just creating a system that leads to overall better health, it shows people that what they want matters. Most people would rather have benefits for obesity treatment and anti-obesity medications than another free Fitbit or a foosball table in the break room. I'm making some progress here, and I will continue to plug away. Thank you to all of you that have taught me and continue to teach me so much about the whole picture. I have always said that I am on this planet to change the weight of the world. I promise I have never lost sight of that vision, and I'm still spending all of my time and energy working toward achieving it.